Well, September will mark 40 years since Americans first heard the CDC use the term AIDS. And by 1992, the agency reported AIDS was the #1 cause of death in men 25 to 44 years old, mostly in the gay community. In the 3 decades since then, AIDS is no longer a death sentence. As we wrap up our Pride coverage this week, one Southwest Florida doctor knows those stories well, based on his frontline experience still treating HIV here to this day.
Inside the Cannes Community Health Center in Cape Coral is a very special doctor. You see, Dr. Doug Brust has been on the front lines of HIV and AIDS since the disease emerged in 1981.
Of course they were afraid.
Afraid because doctors were only armed with testing. HIV, and in its end stage known as AIDS, began to spread across the U.S. in the early 80s. The public presumption was that HIV impacted mostly gay men, but others were infected too.
She got admitted to the hospital. No one knew it was HIV.
Including Brust's best friend, Nancy.
The guy that infected her, I mean, of course, he didn't know. None of us knew he had HIV. He died on the day they were supposed to be married. She didn't get a test until 1985. Because that's when the testing became available.
Nancy would be one of the first women ever to be diagnosed in the U.S., which convinced the then college freshman to switch from evolutionary biology to infectious diseases. And Brust dove into what would become a 40-year fight for life.
That's exactly why I'm here.
From New York to San Francisco, Brust battled HIV, a virus that the CDC says peaked in 1985, with as many as 130,400 new HIV cases a year. And it was the leading cause of death in men by 1992.
Because they would come in and everyone knew they were just going to die because there was nothing he really could do for them.
How frustrating was it as a new doctor trying to figure out this disease?
No, it was really horrible. You get so attached to the people that, you know, all your patients were dying.
The first treatment wasn't much better. In 1987, AZT had to be taken every 4 hours. Nancy secretly took it, but died in 1994, just 2 years shy of a new antiretroviral treatment where things started to change.
And it's not only the stories of patients who die that stick with Dr. Brust, but it's also the stories of patients who can now survive thanks to medical advancements and treatments that you can find right here in Cape Coral. Some of those drugs so effective that he says they could bring people from the brink of death, calling it the Lazarus effect.
There was one patient that, I've taken care of here, truly near death, and was almost being sent to hospice multiple times. Today, I still see him, and, he's able to walk in here, and, he was able to go to his son plays football, he was able to go to his graduation.
Today, HIV is no longer fatal. Treatments are 1 pill a day, and futures are brighter. But a veteran of this historic epidemic remains at his posts, now right here in Southwest Florida.
One of my major focuses always is to normalize HIV. Not make it a secret thing. Just, you get tested. If you're positive, it's just like you have diabetes or hypertension, you're getting your HIV treated. And that really is important.
And in that spirit, Dr. Brust says he wants to see new HIV cases reduce 90% by 2030, a lofty goal he says can be done with one single word: testing, recommending everyone, no matter age or gender, to get tested at least once in their life. And you can do so where Dr. Brust works at the Cannes Community Health Center in Cape Coral. I will link you there right now at fox4now.com.